So welcome everyone to our April spring meeting. It didn't feel like spring this morning, but welcome to our April Meet the Team. We are so happy to have you here with us today. And April is C-section Awareness Month, and this is something that is really important to us. And so we wanted to dedicate this whole Meet the Team to C-section awareness. And I guess I should probably tell you who I am and why I should be talking. So my name is Christy. I'm one of the owners at Helping Hands. I'm half of your host this evening. The other half of the hosts is Jessica Payne, my business partner, and we have a lot of our wonderful team members on with us today. So how things work is today we have 3 topics that we are going to cover. The first one is how doulas support a C-section. And so, how we support this process is a big deal. We have recovery after a C-section, and we have feeding a baby after a C-section. So some of our speakers might overlap some of their information tonight, but that is part of the process. So if you hear something twice, it's probably something that you really need to stick in your head. We are also going to have a question and answer. So I know people get really kind of shy on these meetings. Everyone except for our team has their video off, which is totally fine. Trust me, you can be in your pajamas, and we would be very happy that you are. But if you have any questions, you can save them for the question and answer period, or you can just put them in the chat box. So at the bottom of your screen, there is a little thing that says, Jessica said, hi, please put your questions here. So that is where you can put your questions. But what I would like you to do, just so that you find the chat box and know how to use it, if you could just put your name and, if you are expecting a baby, when your baby is due, and what brought you to the workshop tonight, that would be great. And then after the question and answer, we're going to go into breakout rooms. So this is my favorite part of the meeting, because this is where each of you will be in a separate room and teamed up with one of our team members. So you'll be able to ask questions, get to know them a little bit more as well. So let's get started with our first presenter. So our first presenter is Christiane, not to be confused with Christy, but Christiane. So let's learn a little bit about Christiane. I can tell you a whole bunch of stuff, but let's see what's on here. Her friends like to affectionately call her the baby whisperer, and I would say even not just friends, but our clients will call her the baby whisperer as well. She does magical things. Loves to travel. I'm sure you're hoping that this will be a thing that you can do at some point soon. And you are either succeeding or learning. Unknown, author unknown, which is so true, isn't it? So, Christiane, take it away and let us know more about ways to support a C-section.
Hey everyone, I'm Christiane. I just want to say thank you to everyone that's coming out here tonight. We hope you enjoy the session that we have prepared for you. So I'm just going to talk about a couple of ways to support a C-section. There's a lot of times that it can be planned, a C-section can be planned. So you want to know, hey, well, how are you going to virtually support me? And what I like to do is just start at the beginning, helping to prepare, preparing what to put in your diaper bag, when to pack your diaper bag, overnight bag for you and your supporting partner. You know, it's really important that we have everything that we need, because due to COVID, we can't exactly have in and out privileges. Some of the hospitals are doing one person allowed to come in and out, but it depends on each hospital. So that's what I like to segue into snacks, lots and lots of snacks. You know, I found that all different types of snacks, you know, from nuts to fruit to veggies to, you know, all the good stuff. But I also like to say, you know, a lot of times the birthing parent will actually be craving some carbs. So I really like to say, get some crackers and cookies and maybe a bagel with some cream cheese stuck on it, because I encourage everyone to as well bring cooler bags. You might think it's a bit silly and a bit ridiculous, but the nurses are used to people bringing in little cooler bags. So all depending on where you're at in the pandemic, I think it's really important that we make sure that we're fueled, because as we know, the hospital will give you some food. However, when you're if you're going in for a C-section, you would have started to fast at home. So it's mostly after that we're talking about the snacks and eating after your C-section. So I like to you know, bring some other useful tools into the room as well. Maybe while you're waiting in the labor and delivery assessment area, or if they already have your room aside, but some relaxation supports, music, scents, pictures, pillows. You know, I think some of these are really important. Some people like to bring their robe. Some people like to bring a certain pillowcase, you know, some slippers. There's always these comfort things, because the comfort supports will actually really help you, because you know you're going to be in there for a couple of days, right? When you have a C-section. The other thing that I really think it's a great idea to bring too is some grounding techniques. So I like to bring to the table when you're waiting before you go in for your C-section is some grounding techniques. So there's all different ones that we can work through and see which ones work best for you, which we can talk about ahead of time. And things like music, how I talked about scents. I like to do visualizations. You know, visualize yourself. Where are you picturing yourself? On a beach? Are you picturing yourself with your family? Are you picturing yourself with your baby already on you and born and happy and healthy? You know, and breathing techniques. Breathing is the ultimate tool that we want to emphasize a lot when it comes to C-sections as well. There's different types of breathing. I like to talk about horse lips. That's one I really love. And then also counting, you know, in for 4, out for 4, visualization breathing as well. And these can also be used waiting to go into your C-section. While you're in the C-section, breathing is really important when you're going through the different stages. And even after baby's born, baby's healthy, and they're taking care of the last minute things for you before you can leave the C-section room or the operating room. So I think that's really important, you know. Breathing relieves stress, tension. We want to decrease adrenaline. We want to increase endorphins. So these things are really important when it comes to support when you're preparing and going into the C-section. The other thing I like to touch on too is ways to support a C-section is to talk about what it's going to be like for the incision maintenance and what you're going to be like for mobility, things like that. You know, a lot of times you're not really sure. You're like, well, I was told I can't lift anything. Well, there's different ways that you can lift, and body mechanics and body positioning is really important when it comes to lifting and moving yourself and your baby after you've had a C-section. So it's not just the incision maintenance, which I think is a really important one, which I'm sure we'll get into a little bit later, but keeping it clean, having your shower, letting the soap dribble down and the water dribble down past it, not rubbing or scrubbing it. Some doctors or midwives like to say you can keep it bandaged or have the air at it. That is completely up to your OB. They get to decide how they want you to do your incision maintenance, but we can always help you change the bandages as well if that's something they want you to do at home. So that's some aftercare that we can help with as well. The other thing I like to say is what to expect about pain management. Like a lot of people don't know what pain management looks like and what you can get before you're going into the C-section. So just to like, if you're waiting to go into your C-section and you're nauseated and you're vomiting, or you just feel unwell, you can't drink anything, let's get those fluids going. Let's get that gravel. You're able to get these medications prior to going into the C-section. And we want to move you into different positions as well. If you're waiting for the C-section, sometimes they'll have you lying in bed and they'll be assessing you, but let's get you sitting up. Let's get you walking around a little bit. Just these things to help, again, get your endorphins running. Have your support person rub your feet or tickle your back, or if we're able to be there, we can help these things as well, depending on the situation. Breast milk's not coming in yet. That doesn't mean that we can't do hand expression. A lot of times it'll take a little bit longer for breast milk to come in, maybe an extra day. And that's okay, because we'll hand express the colostrum. We'll, get going, get the pumping going, get whatever's needed to go to help with the breast milk that's coming in, that's going to be coming in. It's just, we want to increase our oxytocin, and we want to make sure that we do everything in our power to lessen the pain, be there for support, and the eating and drinking management we do after. A lot of times people are really, really hungry and they're like, I want to eat right away. Well, let's just start off with some fluids, and then we'll have a bite to eat after that. But just to backtrack to snacks, having like Gatorade and electrolytes and things like that juices are always good to have after as well. Asking for help, which is really, really good. When you're in the hospital and you want to advocate for yourself, you want to ask the nurses to help, you want to ask any questions that you might have had about the birth or about your baby. Asking questions, we help support you in having a voice, which I think is a really important part of, especially when it comes to supporting a C-section, is making sure you have the right to choose different things. You have the right to give consent. You have rights. And I think that's really important that us as doulas will remind you and help you through that process.
Wow, thank you so much, Christiane. That was so much really interesting and important information. There's so much support that we can provide, and a C-section can be just as satisfying and enjoyable as a vaginal delivery. So thank you for that. So now I'd like to introduce a guest. Madeline Golek is a pelvic floor physiotherapist. And so we wanted to have her come out and give her take on the whole C-section thing. She is the owner of Eco Physiotherapy. She is a physiotherapist that specializes in pelvic floor. So it's not the, normal stretches and that kind of stuff. It's a different kind of stretches and strengthening, important strengthening. Trains in Brazilian jiu-jitsu. This was really interesting for me to learn. I was surprised and excited, so I will make sure not to upset you. Loves traveling, so you and Christiane can travel somewhere fun when we're able to travel again. Invite me, I will squish into a bag. So Madeline, thank you so much for joining us, and can't wait to hear what you have to share.
Thank you so much. Can you hear me okay? Because I have microphones and everything all hooked up. Okay,
Yes,
good.
Sounds very good.
Well, thank you so much for having me and allowing me to share the pelvic health physio perspective. And again, I think we were talking about preparation. Sometimes we know that a C-section is coming, sometimes we don't know. And so preparation is really important. And I also want to highlight that it's really important to acknowledge that a C-section is a valid birth, because I know a lot of women or birthing individuals will kind of have an idea of what they want their birth to look like, and sometimes may feel that like it might not seem like a valid birth, but it is 100% a valid way to give birth. And so I want to take a moment to acknowledge that piece. And it's not your fault if you go into a C-section. As much as we can prepare for what the birth journey might look like, things can change, and things can change really quickly, and different circumstances arise. And again, your medical staff is going to be there to ensure your safety and the safety of the baby. So it's not your fault if that's where the labor process ends up. And again, totally a valid way to give birth. We do want to remember that a C-section is a surgical procedure. So my next point is sort of to talk about how, like, if we think of a knee surgery, the physicians will oftentimes give you specific rehab protocols, and they will tell you to go see a physiotherapist. And it just seems really strange to me that, with a C-section, it's not as common to be given advice to see somebody for the rehab process. It is a surgery, and it takes time for healing. And just with a knee surgery, you wouldn't jump right back into exercise. I know usually, you get that 6-week clearance for the exercise, but for some cases, depending on the type of surgical procedure used, it may not be safe to go into, higher impact exercise at 6 weeks. It might take 3 months. And so it's important for us to understand that we are actually healing from a surgery. So we want to make sure that we're not pushing ourselves too fast and too soon. So we're going to talk a little bit about preparation. So one of the big things is as much education as you can get, for example, from presentations like this, birthing education classes, Lamaze classes, hypnobirthing, seeing a pelvic floor physio, seeing a chiro, anybody who can help assist you in preparation of your body, to help you get strong, to help you know what to do, is going to also reduce your stress when the time comes, right? Because when things are kind of happening, you're going to fall to the level of your training, not to the level of your aspirations. That's actually a quote my husband. He's in the military. So, in the military, they train you so that you've practiced it so much that it's just second nature. So it's the same thing when we talk about preparing for birth. We want things to feel second nature. We want to feel that we don't have to think about what to do next. Having a doula. So I've looked at some research that I've looked at sort of 2 different studies that showed that the incidence of C-sections decreases anywhere between 28 to 56% by having a support person with you. The reason for this is if the baby's making its way down and, let's say the pelvis isn't opening the way that it needs to, and baby's position can't seem to get out of that position, your support person is going to suggest, hey, let's try this position. Let's try to move here. And that frees up the biomechanics of the pelvis. So different labor positions, different techniques can help move the process along. And I think that's, why we see a decrease in the incidence of C-section with additional support persons, because they know what to do, where to move you, and what to sort of try. So actually having a doula decreases the risk of C-section. Psychotherapy can be really helpful if you have a lot of fear and anxiety around pain, what the labor process is going to look like. I actually am going to be doing a training on working with labor pain. The more education, the more understanding you can have around what pain is, why it's there, what are these sensations, are they normal, is going to decrease your stress. And if you decrease your stress, you decrease the tension in your body. We want to be loosey-goosey. We want that baby to make its way down unimpeded. But if we're tight and we have stress hormones, it can actually signal the slowing down of labor, right? Which can then increase the likelihood of a C-section. Seeing somebody like a pelvic floor physiotherapist. So as I mentioned, I educate on pain, right? I treat elbow pain And so I educate and teach people about sensations and what those signals in the body mean. We prepare the pelvic floor, we prepare the hips and the pelvis through movement, we prepare the muscles. Guys, labor is kind of a marathon, and it's like one that once you enter, you cannot get out until it's done, one way or another, right? So having your body prepared for the process is really going to help. We talked about preparing meals, also important to ask for help and prepare help in the first 2 to 3 weeks, because it's going to be really difficult to move around. And in fact, you really shouldn't be moving around that much. You also want to set up your space as much as possible. So if you're going to be on the first floor, have everything you need already set up. It's generally not recommended to do too many stairs in the early postpartum. Like, it should be like, if you have to, you're going to do it like once in the morning, once in the evening, but really it's best to try to get everything set up on the main level, at least for the first 1 to 2 weeks while your body is healing. Remember, it is a surgical procedure, right? So preparation is key. And then of course, if you have other children, setting up activities, planning childcare, talking with your partner about maybe taking some time off work, making sure that you have the support, and or hiring a postpartum doula to help you, especially in those early phases. Okay, next slide. So just to kind of give you a heads up of what you can expect in terms of some post-op restrictions, and there will be individual, there'll be surgeon specific, so they will give you those instructions, but just to give you a kind of heads up, like for example, there will be lifting restrictions, no driving for 3 to 6 weeks. So again, thinking about, okay, how are we going to handle, if they go back to school and you have to drive them, we'll see with the pandemic, but just knowing that it may be difficult for you to drive and you may need to plan around that. There's going to be restrictions on high impact running or high impact exercise. And again, I said the first 6 weeks, just because you have clearance to exercise does not necessarily mean that you're, going to go gung ho. You're cleared for exercise to slowly work your way up. Of course, there will be restrictions on bathing and making sure you're not soaking, and light housework for the first 6 weeks, and being okay with things being a little bit messy, like being okay that you can't get it all done at once. And again, if you can get help, even better. And that you're going to be restricted again with that stair movement. Again, we don't want to reopen the wound, especially while it is fresh. Okay. Next slide. Sometimes I go a little fast on my key points, sorry. So just to give you kind of a heads up, again, more from like the body recovery, generally speaking, 6 to 8 weeks, 4 to 6 weeks, if it's uncomplicated. And this will be different for every person. And some factors that may influence that is if you if you were actively laboring before C-section, right? So if it's planned, might be a little bit easier. If it's emergency, there may be some other things going on that may impact the healing times. How much support you have at home. Again, if you're moving around a lot and those tissues are stretching and might take a little bit longer to heal. If you have other children at home, again, that's relating to that support. And then lastly, what was your pre-birth or like pre-surgical level of fitness? So, what was the state of your muscles? Obviously, the more sort of active and fit you were, your body's more primed to handle recovery. Okay, next slide. So again, giving you like little tidbits, like day one, you're probably going to feel all right. You may have some whole body swelling, the medications might still be there. And also just remember, and this is kind of an important key point, that baby may show a drop in weight. And I know a lot of women will, like a lot of birthing individuals will get very worried about the birth weight drop. And that is related to the IV. And so the IV can actually kind of interfere with a little bit of the weight, but your medical staff will be there to help monitor that piece. But if that happens, not to get overly panicked because it may be related to the IV used in preparation for the C-section. Day 3, things are not going to feel very great, and you're probably not going to feel great about having a bowel movement. So there's some toilet positions and toilet postures. If you don't have a squatty potty, definitely recommend you get one. If you don't know what a squatty potty is, Google it. But we want to you want to be aware that things are going to feel kind of iffy. And then week 1, you're going to be slowly decreasing pain medications. You might notice that you're still walking slouch because you're trying to keep the tissue fairly close in the scar. Week 2, you might be down to no medications. Getting around is going to be a little bit easier. Week 3 to 6, you're going to be like, oh, I'm feeling pretty good. And then you're going to get excited about doing more. And I'm going to tell you don't. And for the reason being, again, that although the superficial scar may be healed, there may be very deep sutures in and around the uterus that have not healed and may take 3 months to heal. So although you don't see the scar tissue looks healed on the outside, there still may be healing inside. And, you wouldn't want those stitches or sutures coming open. So just take it easy. Don't do anything strenuous. And then, of course, getting guidance from other healthcare providers on how to gradually increase is going to be helpful. Okay, next slide. Okay, so things that require medical attention: fever, redness, oozing, vaginal odor, maybe likely signs of an infection. So you want to get on top of that just because you don't want abscesses and other things happening. So you should be looking at your scars and making sure if you're noticing something off that you're contacting your healthcare provider. If you get any nausea, vomiting, chest pains, shortness of breath, obviously if the incision separates, please, have that looked at. If you're having heavy vaginal bleeding or like really big blood clots passing, that again, you really want to have that looked at, because again, we want to make sure there isn't any like leftover placenta that could be creating a problem. So please have that looked at. Pain or swelling down into both legs, headaches, especially with positional changes. Want to be kind of looking out for that. And then also looking out for unpleasant emotions. Postpartum depression is a thing. There are some baby blues, but if there's really, things are not feeling off and you're more consistently feeling down than good, talking to a healthcare provider is really important at that time. Next slide. And so a couple of other things to look out for that you may not have thought of is a tight pelvic floor. When they suture, there's fascia. That fascia can pull up on the pelvic floor and can actually make your pelvic floor tighter. So you are at decreased risk of incontinence and pelvic organ prolapse with a C-section delivery, although you still can develop those issues. So you're less likely to, but you might still experience that. So you want to look out for a tight pelvic floor. You want to look out for painful intercourse, pain at the incision, strength issues of the abdominal wall, rectus diastasis. So rectus diastasis, also known as like ab separation, can occur, and there are higher risks if you've had multiple births. And every woman basically develops one while they're pregnant by the 3rd trimester. So we want to be kind of taking a look at if your abdominal wall is doing any doming or tenting. That may be a sign that a diastasis is present. Constipation. Here's a really big thing to be aware of. The C-section surgery can actually put your bowels into shock where they may not work great. So that's why I said at day 3, that first bowel movement may not feel, you might be like, oh goodness, I'm kind of nervous about that. So I teach different toilet postures and positions to help you with that, but just know that the digestive system may do a little bit of shock, and not to be surprised if that happens. Numbness, hypersensitivity, to touch and pressure over the C-section. Again, nerve endings may be cut in the process, and the nerves are going to kind of work their way to regrowing. And because the skin is fresh, you may have sensation changes, and there's lots of things we can do for that. That doesn't mean that's the end of it, but you want to be aware and like seek out help if you're having some of those things. And adhesions. So if you've had multiple C-sections, adhesions just simply means the layers of tissue stick together. For example, like the fascia of a muscle can stick to the fascia of an organ, and then they basically move together, which can cause a host of other issues. So those are things that you want to just be aware of postpartum after a C-section. Okay, I think we're nearing the ends here. Tips for giving birth. Staying on top of your pain medications to make sure that you're able to move around, but not, keeling over in pain, because we don't want anybody suffering. So if they've given you pain medication and it's hurting, make sure to take it as prescribed. Getting up and moving around as soon as you start to feel a little bit better. Like there are some techniques of how to get in and out of bed, how to stand up, but you want to kind of at least stand up, sit down, just to get a little bit of early mobilization. And this will be helpful for breathing as well, because you're going to need to cough. So if you need to cough, here's a really important trick. Get a little pillow or get a big pillow. It doesn't really matter. Hug the pillow lightly over the incision, and you can then brace yourself with a cough, or you can do something that's called a huff. So it's kind of like a cough, but not so much. It's more like a type of movement. Again, this is just to help clear any kind of phlegm or fluid that might be sort of hanging out in there, because again, we don't want any kind of infections in the lungs. Make sure you roll in and out of bed. So the whole sit up business, try to avoid that for the first 6 months, because that's really using a lot of abdominal, might pull on the scar tissue, and will probably hurt. So you want to roll on your side and then push up into sitting. Same thing, lay down on your side, roll onto your back, keeping your knees and your shoulders moving at the same time. That will be helpful. And then using like a bridge to sort of, a bridge being you lift your buttocks and you kind of move it over to the side so that you can roll. These are some early transfer options. So we talked about the air clearing, and then again, ab wrapping sometimes is helpful. C panties, so panties that are higher up so the edges don't sit on top of it. Those are some specific underwear, high-waisted underwear, just so it doesn't rub on that area and again, irritate that healing scar. And yes, avoid constipation. So again, get your fiber in, use your stool softener if you have to, try to make things very easy, and you don't want to get a hemorrhoid as much as possible on top of recovering from a C-section. It's just very, very uncomfortable, but there are medications for that. And if it's red, like if they're throbbing and hurting, please go to the doctor and get some medication for that. And then different breastfeeding positions, which I'm sure your doulas and your lactation consultants are going to teach you all about it, but just keeping in mind that you don't want to be sort of slouching or overstretching. You want comfortable breastfeeding positions. So please, if you're having any pains with breastfeeding, please see a lactation consultant, please, please. All right. And then of course, you can always contact a pelvic health physiotherapist. We do virtual sessions. So in that early period, if you're not sure how to move around or you need additional pain management strategies, you don't know what exercises are safe for you to do, we can actually set up virtual consultations where we can go like this over video, teaching you how you can move and what stretches are safe and exercises are safe for you to do as you're moving through that healing process. Next slide. I don't know if there's anything. Oh, yes. So this is just a list of a couple of products that may be really helpful, especially if you're experiencing issues with the scar tissue kind of overhealing, which is kind of what a keloid is. The body goes into this overhealing. These are a couple of different products. And I believe I've given Christy a printout of everything that's on these slides. including these names. So I'm certain they will send that out to everybody. So you'll have all of this information in case you're like, I didn't write it down fast enough. You'll have it all. That's it. Thank you, guys.
Amazing. Thank you so much, Madeline. I wanted to just take a moment to plug your new course that's coming out soon. So, you know, Madeline has put together a really great course for prenatal to help you learn all the Kegel stuff and how to fix pelvic girdle pain and just so much amazing information. So we will be passing that along to our community as well when it is up and ready. I know you are working furiously to get it out there, but we're excited. I've had a sneak peek and I'm about halfway through, and there's lots of gems in there. So can't wait for it to get out there to the rest of everyone
It's
else.
coming soon, and I'll be sending you the links, and I'll send you the links for the mini training because I officially released it today. So I'll send you the links.
Nice. Awesome. Yes, please be in touch, and we'll pass that along as well. So I have the pleasure of introducing Sarah, who is a postpartum doula on our team. And Sarah believes every woman deserves to be supported and cared for after birth. And I think this was part of the reason why you became a doula, wasn't it, Sarah? Because you felt supported and you really wanted others to feel that way.
Yeah, that's right.
And wants to help families not only survive, but thrive after becoming parents. And this is, I think, something that we're all very passionate about at Helping Hands, because you don't want to have to think about, well, I can't go back and redo it. So we want people to enjoy that time, and you do a really great job of that. So take it away and teach us some of the things we should keep in mind when it comes to feeding baby after a C-section.
Yes, thank you. So hello, everybody. I am Sarah, and let's jump right in. So feeding, the first thing I wanted to mention just right off the bat is that not everyone is going to choose to either breast or chest feed, and that is totally okay. There's many reasons that people may want to formula feed right from the beginning. And just if you are going to do that, you're going to need ready-made formula, because it's not a sterile option in the hospital because you can't boil anything. So I'm not 100% sure if hospitals would give it to you. So you may have to look into that and bring your own. And if you are planning to breast or chest feed, if you have the epidural, you can advocate to feed immediately after the C-section is done. Typically, we say within the first hour is ideal if it's possible. And if you are going to attempt this, you're going to likely have to feed a bit more lying on your back, because you may still be a bit tied up with the IVs after the C-section is complete. So you'll probably need assistance from your nurse or midwife or your partner, whoever's there to support you for that first latch on. If for any reason you're not feeling up to it after the surgery is done, you can wait until you feel ready, and that might be when you're in the recovery room. And in the meantime, your partner or your support person can hold baby skin to skin until you feel ready. And again, if there is significant time that passes and you're still not up for it, you can also request and you can pump at that time, or you can hand express, which is something that Christiane also touched on. And I think that's a great way as well, just to get that milk flowing. And when it comes to positions, so some helpful positions when you have the C-section incision to deal with are the football position. So that's when the baby is kind of going off to the side. You're still going to need some pillows, and you're in all of these positions, you're going to kind of want it to be leaning back a bit, just so that you're in a more comfortable position. And some people also find side lying position is possible, or the laid back position. And if you're going to try the laid back position, you want to have a pillow that's kind of protecting your incision there. So I would say definitely reach out to the lactation consultant that's in the hospital and try to ask them to help you with those first latch-ons, or ask one of the nurses to kind of help you get the right position. And you're going to have to just, experiment and see what works best for you with the pillows and everything that you have there in the hospital with you. So milk supply is also something that can be a concern, or people think about it. We've touched on it a bit already tonight, that sometimes milk supply takes a bit to come in when you have a C-section. That could be due to potential stress, especially if it's an emergency C-section. This stress can also come from vaginal births as well. So it's not only like, oh, this is, your fault because you had a C-section. These can happen, like stress can happen in any kind of birth. So your milk will come in though, and be rest assured you do still have colostrum, which is the nutrient-rich milk that's there even before you give birth. So don't worry, even if your milk hasn't come in, you still do have milk there for baby. And in the meantime, just try to have lots of skin to skin, try to feed as much as you can every 2 to 3 hours or more, basically whenever you want to, just practice and try. And you also should know that supplementing with formula may be a part of your hospital stay and a part of your recovery as well. So just to be prepared for that, you may be asked to supplement with cup feeding. The hospital will provide you with little cups that the baby's not drinking it, but you'll put it by the baby's mouth and they'll kind of lap it up, kind of like a kitten. There's syringe feeding, there's tube feeding, and there's bottle feeding. So you'll definitely be in touch with the hospital staff they can guide you through all of those things. But just so you kind of have a gauge of, you may have to supplement with some formula as well, and that's totally fine. Next is medication. Some people are really concerned, is my medicine that I'm going to be taking with the surgery going to affect baby? And the answer is yes, but it's only a tiny bit. Typically less than 1% of most of the medications will pass into the birthing person's milk. So it's nothing to be concerned about. If anything, this may make baby a little sleepy, but you definitely need to stay on top of your pain meds. So don't not take them to try to be tough, because you definitely need these things to manage pain and for your healing. And lastly, just a couple of tips for when you're at home. I say this for all clients: have a lactation consultant's information ready ahead of time, because you don't want to get home and be scrambling. You want to have this information already. So make sure you have the contact, or reach out to us. We can refer you to somebody, and have that information ahead of time ready, because feeding can be a challenge sometimes and you want to have the information. We've already touched on it. Have those feeding stations or little feeding baskets around the home with diapers and wipes and your drinks and snacks. Those are great to have, especially by the bed. Hopefully you'll be spending a lot of time in bed resting. Rest like it's your job. Your mental and physical well-being are really important, and they're going to help with your feeding journey. And again, we've already gone over this, but I just want to reiterate, this is a major surgery. Your body is going to need time to recover. So manage your pain, accept help, keep it up, and feeding will get easier as you heal. So happy feeding, everyone. That's all for me.
That's all. That was a lot of information. I know a lot of this stuff and I'm going, whoa, this is a lot to remember. So just for those of you who are joining us tonight, this will be available on YouTube, as are the past Meet the Teams as well. So if you're like, oh, there was that thing that I wanted to hear or write down, you'll definitely be able to go back. Or if you would like to share this with other people in your life who might be expecting and that you think this was helpful, you can pass that along as well. So we didn't get any questions in the chat box, but I'm curious if anybody has any questions or comments, anything that they would like to share. You can unmute yourself oh, I like it. Is it important to strengthen abdominals before C-section, and how do you do that safely? If yes, I think this is a great one for you, Madeline. Do you mind jumping in on this one?
Totally. I saw that and I was like, yep, this one's geared to me.
You're like, pick me.
Yeah. So I think this goes, if we think about, knee surgery, there's prehab, right? To get as strong as possible before the surgery to aid in that recovery. So yes, is it important to work on not just the abdominals, but especially the leg muscles too, because you will use them like you've never used them before. Side note. But yes, there are ways that we can exercise the abdominal wall safely. We combine the deep abdominal muscles, usually with breathing. It's gentle. So we're not like doing crunches or sit-ups or any kind of that type of core exercise, but there are specific activations of we call it the deep transverse abdominis muscle. And I teach my clients how to activate that gently so that, of course, you're not also worried about like squishing babies. So we're not going gung-ho, but yes, there are ways that we can activate those muscles safely, usually in combination with the pelvic floor, because your abdominals, your deep abdominal muscles work with your pelvic floor. So if we can get those two combined, that's even better for helping the abdominal wall. Hopefully that answers that question.
Well, this one might also be for you. I know that we know this as doulas, but probably better for you to give us the official answer. But how much longer is a C-section recovery versus vaginal birth recovery? I think this is a little bit of a tricky one.
Yeah, I would say that's a good, tricky question, because it's going to depend also if there's been any vaginal or perineal tearing. So there's different grades of tearing that will impact the healing time. So as like grade 1 would just be like skin level, grade 2 goes into a little bit of muscle, grade 3 goes deeper into the muscle toward the anus, usually grade 4 it goes in like the cut or the tear or episiotomy or combination of both, where the anus sphincter is affected. So the deeper the tearing or the deeper the trauma, the longer it can heal. Of course, those are wounds. They can get infected as well. So that will impact healing. So it's difficult to answer. But again, if you think of like uncomplicated C-section and uncomplicated vaginal birth, you're looking around 4 to 6 weeks. Mm-hmm. So it's about the same. But if there's been forceps or suction or tearing or, et cetera, again, there's different surgical procedures for the C-section as well, which will depend on how many sutures. And of course, if you've had previous C-sections, again, may impact the healing times.
Yeah, I think it's important for everyone to realize that recovery from a birth is recovery from a birth. And each person is going to have a little bit of a different experience. You could have someone who has a vaginal birth and it takes them quite a while to get back to themselves. And then you could have someone who has a C-section who's feeling really good. But we also have to keep in mind the impact of caring for a newborn and lack of sleep and a lot of other things that impact how we feel after having a baby. So really making sure that you take the 6 to 8 weeks to get as much help as possible. And I love that each of you said that in your own way in your presentation. Getting help after having a baby is so important and can make a big difference on how you feel during your recovery time. So I'd love for one of our doulas to jump in on this one. Do you recommend taking formula to the hospital in case we need to supplement breast milk? Anybody want to jump in? The team knows how much I love to talk, but
I can answer it.
Yay.
My name's Jessica. So yes and no. So in a situation where you are planning on using formula to feed your baby and you'd like to have a specific brand that you start with, bring the formula that you're planning on using to help supplementation. Or if you're planning on formula feeding from the get-go, yes, bring your own. However, the hospital does carry formula to help with supplementation. So if there's a situation where, let's say you're not planning on formula feeding, you're planning on body feeding, and for whatever reason, something's going on that's more medical that requires a top up to make sure your baby's getting those calories that they need, not to fret. Everything that you would need to feed your baby include a hospital grade pump, all the supplies that Sarah talked about, like a medicine cup or a syringe or a plastic spoon or formula is going to be available. You just can't choose what formula it is. It's whatever formula the hospital has. I hope that answers your question, Karen. That's a great question to ask.
Yeah, that is a great question. And we also have, you mentioned leg muscles are also important. My OB did not recommend squats, which I was surprised by. What leg strengthening exercises do you recommend?
Again, tricky question when we're talking about general information. So I mean, squats is one of the exercises, as with lunges, for example. But if you're experiencing pelvic girdle pain, then we wouldn't recommend lunges, because pelvic girdle pain usually is a problem with a weight transfer. So there's kneeling squats, there are glute exercises. So there's a variety of like muscle groups that we would sort of work on. However, to get individual advice, always best to actually see a practitioner one-on-one. But the reason that the physician might recommend not doing that could be, again, what is the quality or depth of the cervix? Are there other complications? Are there other reasons that they see that are maybe not like concerning, that they may not have mentioned it, other than like, for example, just don't do this type of exercise. So there are general exercises that we work on, big muscle groups, but it'll be individualized for the person. Generally, if you weren't used to exercising prior to, then you're going to be probably doing more gentle, like prenatal type of exercise. Pregnancy is not a great time to start an exercise program that you've never done before, especially on your own. So like getting somebody to assess you and guide you through, make sure you have proper form, I think is really important and a key.
Yes, I've been watching your videos, and I love to hate that clam exercise. That one, for such a small little exercise, it is like the worst thing. And but it just goes to show that you can do small movements that have huge impacts. And another thing that you mentioned with the customized approach, that's a lot of the stuff that we can teach prenatally is very general, and it may or may not apply to certain people. So important to talk to specialists throughout your pregnancy and find out what might be recommended for you versus maybe just something in general, and go from there. So thank you for all those questions. That was amazing. I love when we have participation from our guests. So let's chat in the breakout rooms. So we are going to break you out into breakout rooms with one of our team members. We do have Madeline here, so if there's anyone who would like to chat with her specifically, please let us know in the chat. We do ask that in the breakout room, if you don't mind turning your camera on. We don't care if you're in your pajamas or have messy hair or messy house, any of those things. But we do like chatting with somebody's face since we are showing ours. But please bring your questions. We can't wait to get to know you and the other people as well. And doulas, once you're finished with one person, come back to the main room and we can pop you in with somebody else. Kind of like doula speed dating.